I'm an orthopedic surgeon, but I focus primarily on the spine. I do all aspects of spine surgery, including cervical, thoracic, and lumbar spine surgery.
Back in 1991, after I returned from Turkey, I was active duty. I had a bad motorcycle accident where I totaled the bike and had multiple injuries. I've been in back pain ever since, misdiagnosed several times until I came across Dr. Hoskins with considerable research my wife and I did. Finally, two and a half years ago, he did my surgery, and I'm happy to say 3 weeks ago I just picked up a brand new motorcycle, and thanks Dr. Hoskins, I can ride again.
Within Orthopedic Institute of Dayton, all the physicians actually did subspecialty training beyond board certification in their particular field of interest. For me, that's spine surgery. That is not a certification process, it's actually additional training.
I came to OID because I was in constant pain. I had this constant pain for a month. I came to see Dr. Hoskins, and he ordered the MRI, which showed the problems with my bulging discs. He fixed the problem, so I was no longer in pain for the first time in 30 days, and I was back to work in 4 weeks.
My injury started about 5 years ago. I lifted my mother and I broke my back, and we discovered that I had osteoporosis. After that, the pain kept increasingly getting worse and worse and worse, and then the last half a year, finally, I decided to see Dr. Hoskins.
The benefits of the type of surgery that I do, often the patient comes in with severe pain, and I'd say that's probably the most frequent issue. The surgery is designed around pain relief. That involves removing pressure on nerves, whether it's in the cervical spine, thoracic spine, or lumbar spine, and creating more room for the nerves to exit freely from the spinal canal. And oftentimes, in conjunction with this decompression, we have to stabilize the spine because we actually create a little instability with surgery, or the patient may have pre-existing instability, and so we do a fusion procedure along with that.
I woke up after the surgery, I had no more pain, and I literally had no more pain. Now I had surgical pain, which was totally different than from the other pain. And like I said, I cannot explain or express what a relief that is.
Well, in terms of patient care, the first thing that I like to do is try to focus on the patient and try to understand what they're wanting out of the physician-patient relationship. Oftentimes, patients just need reassurance. Sometimes patients actually come in looking for surgery and are surprised to find out that that is actually not the most appropriate treatment method. So I think really listening to the patients, trying to find out what they're looking for out of this, and then incorporate that to your clinical knowledge.
Ever since the surgery, I have had not one problem, and I have been like the way I was before I had the problems.
I honestly can say I have no pain compared to what I had before. Absolutely not.
I'd recommend Dr. Hoskins to anyone out there that's having problems with their back, especially the severe pain that I was having. If you do the research, if you ask around word of mouth, you'll find he's probably the best in the area, if not in the United States, because I did thorough research. He made me feel very comfortable, and he gave me back my life, and I appreciate it.